Industry Strategy and Tactics. And I'll pass it over to Tanya here.
Hello, yeah, I'm Tanya Williams. I am part of the Wellbeing and Fitness team here at Garmin. Also co-lead with Missy. Super excited to kind of jump right in and get these wrapped up and on to some of our tactics, hopefully, this meeting.
So a quick review of what we went over last time. Uh-oh, Natalie, I think we lost you. There we go. It is our strategy and tactics. We finished up our strategies 4 and 5 last week. I thought we all had really great discussion over the different questions that we dove into around the strategy 4 and 5. For a refresher, strategy 5, physical activity and public health professionals. We dove into where it's already being done, who can help implement it, the barriers to implementation and to success, how we can strategize to overcome that, and who we're missing in these discussions. As a reminder, as we go through this, those who we are missing are valuable input. And so definitely if you know someone that would be a great contributor under one of those who we are missing topics, please reach out to Tanya and I. We'd love to get them included into the conversation and to get their perspective on all of these as we move through the strategies. Any questions on where we left off on 4 and 5? Natalie's switching over to 4 here, just so you can all read over them. I don't want to dive too much into them right now, but I do want to give you an opportunity to read through them. Tanya, did you have anything to add on this?
I don't think so, no. I think we added a couple who were missing a day or two or end of last week for 5, but I think other than that, it looks good.
Yeah, 5, we did add, you're right, we did add potentially reaching out to K-State Research and Extension and Lenexa, as well as finding some support and touching base with the public health sector as we need them for additional support on this strategy 5, since it is pulling in those public health professionals into the development of these systems. So we did want to make sure that we include them as a resource for when as needed. And definitely if you feel like they're needed and they're not in the conversation, we can always reach out to the public health sector for additional support as we strategize. All right, so any questions on this? If not, we'll move forward into this section. And Natalie, I'll let you describe this. I feel like you'll be able to talk through a little more on how you want us to manage this next part.
Yes, I'm going to share a link in the chat, and that'll allow you guys the ability to access our Jamboard.
Perfect.
I've listed the strategy here for y'all to read, and then you're going to be able to drag these Post-it notes over to this matrix and drop them where you think it relates best to the strategy. So it'll help us identify some of the low-hanging fruit, which would be strategies that we think will be easier to implement, as well as maybe help us prioritize which strategies we want to target moving forward, or which one we'll maybe focus on later, based on how challenging they'll be and how much impact they'll have.
Yeah, and we also want to focus on like our highest priority as well as implementation. Which ones we feel like has the highest need in the Kansas City region, and as Natalie said, help us to really strategize how we want to implement all of these and which ones we want to focus on first. So I saw that just come through in the chat for me. Is everyone else getting the Jamboard opened okay?
And then I believe it's slide 6 that we'll start on.
Oh, yeah. Thank you.
Could you stick it back out there? I didn't grab it, or I don't see the link.
It should be in the chat.
Oh, in the chat. Sure. Okay. Here we go. Got it. Thank you.
Yeah. And then anyone still, we'll let this load. And then let's see. Okay. Anyone still waiting to get that Jamboard opened? If not, so we're going to start with strategy 1. Businesses should provide employee opportunities and incentives to adopt and maintain a physical active lifestyle. Go ahead and rate this on how you feel, where we should place this in our prioritization list. Once again, you know, that implementation, how easy or difficult it's going to be to implement, the challenges around long-term implementation, quick wins, things that we can implement quickly and get an impact moving, as well as kibosh or just, you know, completely ignore. All right, I'll give everyone a chance here to prioritize that. Go ahead and put your little block. 2, 3, 4, 5, 6, 7. I think we might be waiting for one more. Perfect. All right. Yeah, I definitely agree. Some possible quick wins here, as well as that high priority with implementation. Any discussion notes around why we placed this, why you placed this where you did? You can add them into that discussion notes section, or we're happy, you know, to have that open discussion and dialogue as well. With possible quick wins, does anyone have just some off the cuff ideas on how to make some quick wins with this strategy?
This is Shelley.
Hey, Shelley.
Hey, I am staying off screen. I'm recovering from a minor procedure and I'm not quite back to 100% yet, but thought I would jump in here for just a second, because as I look at this and think about the very first conversation we had about this strategy, it seems that most businesses, and I can't say all, just because I'm sure there are some smaller ones that may not be implementing employee wellness programs like larger ones are, but for the most part, large businesses have employee wellness opportunities and incentives included as part of their incentives and benefits programs for employees. So I see that as one of the reasons why most of this is ranked in the high priority and easy to implement, because it already is being. One of the things that I think about is how can we learn from other organizations what's working well. There may be a way that this is being done already. That's why I'm asking the question, because this isn't where I sit within Children's Mercy. I don't sit within employee wellness, but that's why it's so important for those of you who do to help us inform do we already know what's working well? We already know which types of programs should be included in employee wellness or employee well-being programs, but do we actually know the types of things that are working the best? Examples being on-site fitness versus potentially subsidizing the cost of participating in whatever physical activity program you want to participate in. Group classes versus individual, health coaching versus something else. So I just wanted to throw that out as we're thinking about as we get into the strategy pieces of these, and we notice that this is a high priority or easy to implement, high impact strategy. I just wanted to bring that up. Again, as we switch into the tactic piece, as something to think about.
Yeah, I mean, I think it comes, the metrics that we're talking about, maybe on how are these current strategies and programs that these companies are doing, they probably have they probably have some type of tracking for, outcomes, and their outcomes could be some clinical, but I think a lot of it might be, days showing up. There's ways that they can measure morale and, mental health and different things like that through surveys. So I think those are kind of the metrics that they're probably looking at. Attendance days would be a big one. Days that they attend work where someone that's not very healthy or, having anything from diabetic to, frequent colds and respiratory, they would have some way probably to track that.
Yeah, definitely. And I definitely agree. I think that businesses, especially the larger businesses within the Kansas region, do already have some employee opportunities and incentives in place, whether on site directly through a contractor or even through their insurance. And so I think that those different opportunities available to them and the different avenues in which those are presented to employees, we definitely will want to keep in mind when we start looking and diving deeper into this strategy. Any additional thoughts? If not, we can move into that strategy 2. Okay. So for strategy 2, businesses should engage in cross-sectorial partnerships to promote physical activity within the workplace, and such efforts should extend to local communities and geographical regions. Once again, go ahead and drag that over as far as implementation, easy to hard, challenges as well, kibosh it, or possible quick wins. Take a moment to look over it and kind of think where this best fits. I'm thinking about impact as well as difficulty on this. So everyone had a chance to put in where they're thinking. As we finish up putting in our selections, definitely want to have those discussion notes as well. I think this is also an opportunity to look to see what companies have already implemented and what they have on site, as well as like potential opportunities that we can just create those partnerships to engage with what's already going on site at businesses and industries. What are everyone else's thoughts?
Hand in hand with what Shelley shared with the previous strategy, creating a network to idea share and brainstorm with what's successful in different businesses is kind of where this falls in my mind.
I agree with that. I think the network component of this is going to be extremely important, especially creating those cross-sectorial partnership opportunities. Does anyone foresee any challenges? I know some of us marked closer into the challenges. What were there any specific that came to mind with those challenges?
I think having, opportunities like Healthy Casey and that sort of stuff are kind of getting us off on that right foot to get started.
I definitely agree.
And I always think liability and cost are the two most difficult things to try to navigate. So depending on what it is. So for example, I always think of Corporate Challenge as one of the best examples of a cross-sectoral partnership that promotes physical activity in the workplace. And I'm not sure how they successfully navigated all of the liability issues with implementing so many different types of sports at so many different locations. And then how do they establish the budget and navigate those costs? Clearly, businesses think it's worth doing because they participate and have been participating for what, darn near 50 years.
45th
now.
season this year. Yep.
45. And so clearly there are ways to navigate this. And there are so many places for physical activity that already exist, but challenges exist with, each organization feeling like, what am I going to get out of it? What are the costs I'm incurring? What happens if somebody gets hurt? How do we navigate these liability issues in a way that's does not put an undue burden on a single organization, but allows the partnership to take on more of those responsibilities a little bit more equally. I don't know exactly what that looks like, but I think, again, having a network of people that are trying to address these things and figuring out how we do it together is really a great start to try to identify how we're going to move through this.
That's perfectly said.
Yeah, and I think like the assessment, there's always assessment involved, and even in the wellness, so that's one of those, I'll say, protections or steps or strategies to place, members and community members that are wanting to be involved in these kind of different programs and stuff. To make sure they're in something that they can do to minimize injuries and things like that. So there's a little bit of gatekeeping, I suppose, sometimes.
Anyone else?
So, Missy, can you hear me?
Yeah.
So we just met with a company today, probably had 600 employees is what they kind of have with their company. And so they were just exactly talking about this. How can they expand their wellness program? One, to incentivize folks to do, to participate in Corporate Challenge more because they wanted better participation there. But two, how can they do it to, make it better overall, their wellness program, and incentivize them to go do things, exercise, and, and all those things within there. And, when we started talking about some of the different things like what JCPRD does, you do so much and you get a half day off, or you can get a full day off, or whatever it might be. And Casey Mo does a lot of good things, the same concept. And, there's a lot of companies out there to do it. So they start talking about, it's always the money situation. If we're going to incentivize our folks to do it, what's that going to cost us? Whether it's days off or other incentives, and things like that. So that's always, the first step with all this. But I think there's a lot of companies out there looking to figure out how they can expand what they're doing now to just to get a little bit more out of their employees. So just a little FYI there.
Yeah, definitely. And I agree with that. I also think a lot of companies are looking at it as a connection opportunity within their companies. So many people, so many corporations have lost that interconnection. And so, or it's decreased. And so rebuilding and reinforcing that connection between their employees. And cross-sectorial partnerships are a great opportunity for that. Things like Corporate Challenge provide those avenues for the employees to connect and engage with one another outside of just the day-to-day work that they're doing together.
When I think
And-
Corporate Challenge has taken it kind of a step further within the community and now has slowly started adding youth even into it, right? So now, once before, maybe it was harder for the mom or the father to step away for the 5K or something. But now that we are adding the community to some of these events, I think it's made it easier for those parents to kind of get the whole family involved.
Yeah, that next generation. Wonderful. Any additional thoughts? If not, we can slide on to strategy 3. I don't want to cut off discussion though. All right. Let's go ahead and move on to strategy 3. Tawny, you want to take this one?
You can take this one. Professional and scientific society should create and widely disseminate a concise, powerful, and compelling business case for investment in physical activity promotion. So determining if we feel like it's kind of where the difficulty lies and then the impact it can have.
You're waiting on just a couple more. While the last few make their selections, we can dive into those discussion notes around this. For those that said challenging, do you foresee any specific challenges around this strategy?
This is Shelley again. My question here is, does this already exist? So in some of the wellness organizations or associations that exist across the country, has a concise, powerful, and compelling business case for investment in physical activity promotion already been identified? In the medical community, it has been. So we know that exercise is the cheapest, most effective reducer of chronic disease that exists. I don't know whether that same ROI case has been made from the business perspective, meaning it's worth employers investing in this because they're going to have more productivity. There is some research around that. I understand that. I just don't know the body of research widely to know whether or not this already exists. So that's why I put this as somewhat hard, but very impactful. Because making that case is going to be very important for businesses to buy into and invest their money in whichever way they do it into programming, supporting both physical activity from this perspective, but well-being activities beyond just physical activity. Individuals don't care. We do not need to make the scientific case for individuals because it's been being made over 50 plus years and rates of physical activity still aren't increasing. And so I think in my mind, what has to happen is these things have to be more accessible, more fun, easier to attain, easier to fit into your daily life, easy to, as we just mentioned with what Corporate Challenge is doing now, easier to incorporate your entire family. That makes it more desirable to the individual. So again, the reason I put this as somewhat hard but very impactful is because I'm not entirely sure if the case is being made. If it is being made, that's great. Maybe what we need to do more from a tactic standpoint related to this strategy is getting the word out and making the case in a way that's a bit more meaningful, both for individuals and for businesses.
I agree with that. And I do know that there are some professional and societal scientific studies out there for businesses, but definitely creating that avenue to get that out there, that convenience factor, the enjoyment factor, and the impact that it has on their employee health, overall employee health, their health insurance costs, all of the benefits tied to that for the business and industry sector. There's a lot of value in getting that information to them because many of them might not realize how big of an impact that has.
Yeah, I would agree. I think the research is out there, but I think it's just slowly making its way across employers. It's just taken a longer time to, for certain employers probably of different sizes to actually get kind of on board with how beneficial it is.
Yeah.
Yeah, and and I think that's exactly something to consider and maybe make a note of here. By implementing these programs, your ROI doesn't improve overnight. It doesn't even necessarily improve in the first year. And the more turnover you have, probably the longer it may take for your ROI to improve.
Mm-hmm.
But understanding that piece, I think, is going to be, and being able to communicate that is going to be important for us as we think about this strategy and potentially identifying tactics for this strategy.
Yeah. Does anyone else foresee challenges or difficulties around implementation of this strategy? Or even insight into possible quick wins or high impact ideas?
There's a lot of moving parts with this one to coordinate and pull together, and it just seems a little bit more multi-level than some of the others.
Yeah.
Yeah, and I think we've mentioned this before. We are trying to look at and gather the evidence, but not being in the field, we're not necessarily the best ones to know which ones are the most, like, what are the most effective research articles that businesses want to see, or what are people using?
Mm-hmm.
If any of you know of that research evidence that we should be gathering and sort of collecting as our library of resources to pull from, please feel free to share those with us, and we'll save them in a way that's accessible both to this group and other groups. But first, we want to just make sure we're gathering the right information.
And Shelley, would you like that information sent directly to you, or shared, with who specifically?
If you'll share it with Natalie and I, that would be great. And again, we can be the gatekeepers and make sure it's accessible to anyone if everyone wants it. We are currently working on how we best link resources for the different sectors on our website. We're trying to do it in a way that's not overwhelming. So we're testing a few models, but we'll start storing them in our own individual team files and then share them with anybody who happens to want to see what we have or wants them as well.
Wonderful. All right, do we want to move on to strategy 4?
Strategy 4, professional and scientific societies should develop and advocate for policies that promote physical activity in workplace setting. Do we feel like this is already being done?
I was about to say the same thing. I feel like this is a little bit like the strategy 3, where there are some opportunities that this is already taking place. For me, one of the challenges is identifying them and getting them to promote that within the workplace setting and kind of to the greater masses. What are your thoughts?
I think this goes back to a comment I was making earlier. So for example, in the physical fitness or let's see, in like the American College of Sports Medicine, and that's a variety of healthcare professionals, including physicians, exercise physiologists, dietitians, athletic trainers, all can be members of that organization. That group is supporting and advocating for policies to promote physical activity. Whether, and I would assume they're doing it in a variety of settings. I'm not entirely sure. They may just be doing it in specific areas. For example, the one I know the most about is exercise is medicine. That's advocating for physical activity being included as a healthcare vital sign. So your primary, when you go in for your well check, you would be asked about how much physical activity you're getting, etc. Is it also being advocated for in school settings? So, you know, we need this amount of recess or this amount of PE. You do hear of that going on, but it's likely a different organization that's promoting that. And then you go into employee settings or business settings. That's likely a different organization. So how do we get these organizations aligning efforts, advocating primarily for physical activity, and then identifying that it can't just be, we're just identifying for physical activity. It has to be physical activity in all the settings of society. We've got to advocate for it at schools, in early care and education settings, at doctor's offices, with Parks and Rec. The list goes on. I hope that makes sense how I'm trying to state that.
Yeah, and I definitely agree. ACSM American College of Sports Medicine is a great example of how they are advocating across multi-sectorial divisions. And definitely beginning to identify the societies that are focusing in on that workplace setting and how do we advocate what they're presenting and putting out there. I will say
Yes,
another organization that's great is WellCOA, the Wellness Council of America. They do a lot specifically with workplace settings, with getting activity in the workplace.
yeah, so this goes back to Tanya's question. Yes, I do think it is being done, but is it being coordinated in a way that allows us to organize and propel the work forward versus being distracted by, oh no, I can only focus on the school setting at one time, or no, I can only focus on the healthcare setting at one time, or
Any other comments or thoughts?
Trying to think of some of the policies, like the way we design our neighborhoods and parks, actually build, our sidewalks and our green spaces, are some of the ways that, or some of the policies that would kind of affect and evolve through this. So you could have city engineers, the way traffic flows. I live in Brookside, and they designed a little. I hadn't killed anybody down there, but I've been almost killed walking across Meyer Boulevard. But those kind of policies are kind of what we're talking about. That's one area. It seems like it kind of goes back to what first has to be brought up is the cause and effect. The data that shows, hey, when we have active society, when we have active communities, this is the result, and we've shown this is a neighborhood that's not doing it, and this is a neighborhood that is doing it. And their A1C levels and their, all the metrics all fall into place. I think of all the associations too that promote exercise. I mean, like the diabetes, the heart association, cancer. I mean, they all in their literature speak to this.
that's exactly right.
Lots of
So
people doing it.
so
Very
do
true.
health departments in their community health improvement plans. And if everyone is doing it, why in the world can't we coordinate in a way that really moves some of these things forward in effective ways?
Well, for so long, medical data and the stuff we're talking about was all on paper. Now we've got the data, and that's why now in the last, I mean, probably that we could have done it 10 years ago, but there's better data, more of it, and better CPUs to run, big data to run and calculate and pull all the information together to use it, you know. So I think that's really happening across healthcare with you know, pricing and actually how business is done, transparency and outcomes. The value proposition is really the story starting to get told because of that. So better data science, I think, is what's really kind of pushing it and going to help us be able to action, you know, bring this.
Perfect. Do we want to move on to strategy 5? Yep. Okay. Let's
Yeah.
move on to strategy 5. Physical activity and public health professionals should support the development and deployment of surveillance systems that monitor physical activity in the U.S. workers and physical activity promotion efforts in U.S. workplaces. So you can even think about this more of even physical activity in Kansas City workers, Kansas City regional workers, and physical activity promotion efforts in the Kansas City, greater Kansas City workplaces. If you wanted to narrow it down even a little more.
I did update that language when we move on to the tactic discussion. I just forgot to on here.
I'm looking at like surveillance systems, the deployment of surveillance systems that monitor our activity. So we know, kind of goes back to kind of the, you know, not many people walk to the store. We know that we're so time constrained to, you know, dash here and there that we don't do what's good for us sometimes. But the deployment of surveillance systems are ways to measure physical activity. I was kind of thinking about wearables. You know, I don't have one, but so many people have steps, watches, heart monitor. And they're getting more and more information. And again, that's that data, how to track it. It's pulled from everywhere.
I think even most phones these days, if your phone is on you and you're walking, it's counting your steps.
Yeah.
I don't have an Android, but I'm pretty sure the Apple phone does that with one of their apps that's automatically downloaded with the phone.
The health.
Apple Health, yeah.
Yeah.
Yeah, so we're doing it. We're just, but do you ever look at it? I don't. Once in a while I open it up and I'm like, oh my, hey, oh, that's telling me, and I don't know why it pops up, but sometimes it does. And it's, if you hope it's good news, and it says you've been moving.
Yeah, Dan, to answer your question on are we looking at it? The discussion notes just highlighted what I was about to say is many companies do incentivize their trackers through incentive programs, wellness programs, as well as health insurance sometimes will do different things to help incentivize movement. And so I think there are some things already out there where this is happening. But continuing to promote those efforts and to expand on them. I would, I think this is one which we touched on at the beginning of the meeting, partnering at times with the public health sector to see how we can expand and incentivize that further and promote efforts further. I think there's going to be a real opportunity there to work with that sector as well on how we can expand what's already going on.
Yeah. Yep.
But I do think this, for me, I feel like this is a real challenge on how best to deploy and monitor those efforts. I think there's opportunities for that deployment, but the monitoring of it is where I foresee potential challenges for us. On a personal note, I don't know how everyone else is feeling.
So there are third-party companies, but I think with that, the hardest part for organization is the cost of
Yeah.
those third-party companies that allow you to see all the data
Mhm.
that's been tracked.
Well, and then you're talking about policy, it's state, federal, a lot of it's federal grant match money for for all of Medicaid. I mean, half of it's federal money, half of it's state. And then there's different grants within that do different things. But different state initiatives, and I'm thinking like the Department of Conservation, they might have something, an outing for people, seniors, where they go out and watch, eagles, or, so there's all kinds of programs, and that's kind of where the rubber hits
Yeah.
the road, is those kind of things. I think they've done them for a little bit and they're seeing the improvement of it. But I think the growth will come through, legislation to, hey, that investment, where else can we do it? How else can we bring to bear these benefits
Yeah.
in a cost effective way? So they're probably, again, the information is there, is just really
Mhm.
getting it out to the public,
Yeah.
to the decision makers at companies and healthcare companies, and as well as the policy people, in government. All
Yeah,
these
and
little pieces have to link up, and they will.
yeah. Yeah, and with the Kansas City workers and the Kansas City workplaces, I mean, great point with the, conservation department. I know Missouri, I think might have been nationwide, but I know Missouri did their trail initiative to get everybody out on trails on the first of the
Yeah.
year, and to hit the trails and do a little hiking. And so that's a great example where, is there an opportunity for us to then take that, piggyback off of that, and partner with them to promote it for like walking work breaks and things like that on that first of the year initiative as well. That's a great, point of finding those opportunities that already exist within the local government, and how can we expand on them, or even just piggyback off of them a little bit.
Yeah. And it's so funny, they do them once. It's like always an annual deal. Why don't they do them every other week or monthly, or, they
Yeah.
because it's cookie cutter. You just, reprint the flyer, send the email out, change maybe the location, make it interesting. Because, like you say, it's got to be fun. It's got to be interesting. It's got to have, there's got to be some kind of motivation above, hey, you're going to go out and sweat a little bit. We're going to get a little fresh air. Although that's kind of nice to look forward to, but
Yeah.
it doesn't seem like those events are, there's not a lot of repetition. Of course, we live in a kind of a cool environment, but there are people that like to get out when it's like this today and walk.
Yeah, and that's another great idea, is partnering, touching base and partnering with our Parks and Rec department to see what they're doing for their trails initiative. I know Johnson County does a big trail push every spring. I've seen things for Platte County as well. So I do know that our regional counties are doing pushes for their trails. But so there might be an opportunity, for different things like that, where there's that additional partnership opportunity for those Kansas City workers and those workplaces. Yeah, perfect. That's a great example. Anybody else have additional thoughts? I want to be mindful of everyone's time. I know we just have a few minutes left here. All right. How are we doing on time?
Do you want to stop there?
I think that's a great
Versus
stopping
diving
point.
in.
Natalie can discuss a little bit, but into this, but we did want to touch on our next meeting. We will be diving into the individual tactics under each strategy based on our rankings that we did today. We used the national tactics as our baseline, but we will be zeroing in on the Kansas City, greater Kansas City region specifically. So as we're going through these tactics, for example, this first one being adopt policies that support and implement the implementation of, I have my screen half covered, hold on. The implementation of evidence-based programs and initiatives. When we dive into that, we can definitely customize any of these tactics to better zero in on the greater Kansas City region. We can also add tactics or adjust them to fit what we're needing to do for that strategy. So between now and then, take some time, read over the national tactics, and take some time to digest and come to that next meeting ready to discuss if it's already being done, who's doing it well, and what some common barriers to success may be, and maybe some tweaks and adjustments to the tactics that we can implement. Anything to add on that, Tanya, Shelley, Natalie?
Are we looking at the 12th for that meeting?
Yes, February
Yes.
12th.
Here, I'll put the registration link in the chat.
Thank you.
And that will be February 12th at 2:30 p.m. Central. And then Natalie, I will let you end us here by sharing some other sector updates going on.
Sure. I wanted to talk about our media and communications sector. They have launched our Move Together KC campaign. For those of you that weren't able to attend our quarterly meeting, they were the ones that presented at that one. We also have the video recording on our website if you want like more of the details on that. They have sent out a request to all the sectors to help them with the storytelling aspect of that campaign. Let me share my screen to show you the announcement. Oops. Can all of you see that, or is it too small?
I can just see you right now.
Yeah.
Oh, sorry.
There we go. Everyone else can see it okay?
Yes.
Okay.
So it's going to be a collaborative effort, cross-sectoral, all of our KCPA plan sectors, to share why and how and why it's important to you to be active and move your body. This link that I'm going to put in the chat allows you to either tell it with text, or you can upload a video, and then we'll be promoting those on our social pages. It's also a way for organizations, if they need some free marketing, it's a good opportunity for you to get shared that way too. Let me share in the link.
Hey Natalie, I'm gonna pop in if you don't mind really quick. So I work with Natalie. And I help with our media and communication sector, but I posted our socials. If you'd like to also follow our socials, as Natalie stated, that these stories will be used on that.
That maybe didn't work.
Natalie,
I'll
I
share that in the newsletter again as well.
I just posted the actual URL for the
Okay. think that's all we have to share unless anyone else has any organizational updates that they want to share with the rest of the group.
Awesome. Well, thank you all for attending today and moving forward with this. And hopefully we'll see you all back here in February.
Yeah. Everyone enjoy the rest of their
Very good.
January. Stay warm and safe. It looks like the snow is starting to stick a little bit.
Thanks, guys.